Also right now at 4:30, millions of Americans now eligible for a third dose of the COVID vaccine. The CDC voted unanimously today to approve the FDA's recommendation to give boosters to people with compromised immune systems from things like organ transplants, cancers, and other health issues. Dr. Anthony Fauci says anyone who doesn't have a health issue does not need one right now, but that could change if the vaccine protection weakens.
We're going to be ready to do it whenever the data shows that the protection has gone below a certain level.
Now, joining us this afternoon to talk more about this is Dr. Henry Anyimadu, an infectious disease specialist with Hartford HealthCare. Doctor, good to see you again.
Good to see you, Mark.
Were you surprised by this announcement today? There's been so much talk about a booster shot potentially coming soon.
That's right. It's not at all surprising. This is something that we've been looking forward to. And it's a very welcoming news because we know that immunocompromised patients or people with decreased immunity are definitely at risk of very poor outcomes when it comes to COVID.
How soon, doctor, do you see this beginning, these third booster shots for people?
I think we will begin to see that as soon as next week. Wow. Because the CDC has approved just this afternoon that it should be given. I think the challenge was defining who is immunocompromised. Yeah, and that has been teased out with some clarity.
I was just going to ask if you could explain what that means for folks who are wondering if they're immunocompromised.
So it's a wide spectrum of people that we call immunocompromised. So what it means is that their immune system is not strong enough to fight off infections. And in general, it's patients who have had solid organ transplants like kidney transplants, liver transplants, and are on some immunocompromising or immunosuppressive medications. Again, there are HIV patients whose HIV is not controlled. And there are also people who are on chronic steroids or prednisone for a very long time, and a lot more people who are on other immunosuppressive medications. So these are the people that we call immunocompromised patients, and these are the group that is being targeted for the third dose.
Do you think, doctor, this is the first step? So we start with this group and then potentially in a few months, perhaps, other folks who have the shot but don't have any health complications would be getting a third booster, I guess technically a first booster after the first two shots.
That's right. So that's something that's coming. We know that it's coming because we do know that immunity will wane after a while. So yes, it's probably coming, but the CDC is closely following the data so that they don't do anything preemptively. But I think at this point, what we really need to do is to make sure that we are getting vaccinated because there's still a third of the population that hasn't gotten even a single dose of the vaccine. So we really need to encourage people, especially if you live with someone who is immunocompromised or if you're around someone who is immunocompromised, you definitely want to get your vaccine.
Yeah, it's good for you, but it's also good for others around you. Dr. Henry Anyimadu, it's good to see you again. You know, the positivity rate drops and we don't see you for a little while. Now things creep back up and here we are again talking to you, but it's always good to see you and hear your advice.
Happy to be here.
We'll see you soon. Hopefully not, but you understand what I'm saying about that.
That's right.
Thank you, doctor, very much. Have a good weekend.